Hello, this is Shay Pfeiffer, and this is my video study comparison on does father-to-child skin-to-skin contact in the immediate postpartum time period change paternal hormonal expression. These are my two studies. The first is increase in oxytocin from skin-to-skin contact enhances development of parent-infant relationship. And the second is father's cortisol and testosterone in the days around infants' births predict later paternal involvement. Research problem or purpose. For the first study, the purpose of this randomized crossover study was to examine oxytocin and cortisol levels in order to determine whether skin-to-skin contact reduces paternal stress and anxiety. For the second study, the purpose was to measure father's cortisol and testosterone levels after performing skin-to-skin contact with their newborn in order to predict future paternal involvement. Study design. The first study was a 3-day randomized crossover study of 28 English-speaking couples over the age of 18 with no history of depression. The infants had a period of gestation of 30 and 0 to 34 and 6 weeks, and they were 3 to 10 days old, with orders for nothing by mouth, had not been intubated, had no anomalies, no history of hemorrhage or surgery. The study included 2 separate sequences. Day 1 was maternal skin-to-skin contact, Day 2 was paternal skin-to-skin contact, or they were assigned to the exact opposite. Saliva was collected and a self-reporting visual analog scale for anxiety was completed. The second study was a longitudinal and cross-sectional study with 298 participants, identifying as male over the age of 18, with an infant born at Memorial Hospital in Indiana. Participants were instructed to hold their infants using their chosen method of either skin-to-skin or staying clothed. Saliva was collected before and 1 hour after, and again a paternal self-reporting visual analog scale was also used. Study findings. For the first study, they found that skin-to-skin contact salivary oxytocin levels increased. This led researchers to determine that skin-to-skin contact may be used to enhance the preterm infant-parent relationship and to decrease stress and anxiety in both. The second study found that lower basal testosterone contributes to enhanced paternal direct and indirect care. Higher basal cortisol correctly predicted a higher level of future paternal involvement. Analysis. For study 1, the internal validity was fairly weak due to the study design not allowing for a clear causality with convenient sampling. And study 2's internal validity was also fairly weak due to the paternal self-reporting of both behavioral and the degree to which they were personally, directly or indirectly involved in child care. Self-reporting and reflection is not a scientific guarantee that these, quote, viewpoints are accurate. External validity of study 2 is fairly high as the study addresses key components that have been missing in research of the development of biobehavioral responses of parent-infant interactions. And again, the external validity of study 2 is fairly high due to the study's synchronous model aligning with past theory-based viewpoints that have explained the associations between cortisol and future parent behaviors. Future research. For study 1, future research would benefit from a wider sample size of cross-cultural participants, not just white participants that spoke English. This would have the effect of giving validity to the study and go a long way in changing the standard of care to routinely include both maternal and paternal skin-to-skin contact across the board. Study 2, future research would benefit from a wider sample size and observational research versus self-reporting. However, though limited, this is an excellent trial that has the potential to enhance both in and out of hospital policy in regards to paternal skin-to-skin contact. These are my references, and thank you.